been a lot longer. So when I, or many of you who are clinicians, are in the office trying to decide which test to use for this patient, we need to be aware that we use different tests depending on the purpose. After the injury, we would like to do some tests, but maybe other tests to evaluate the treatment, effect of treatment and rehabilitation. We want yet another test for preoperative assessment. We use functional tests in the rehabilitation as milestones, and very frequently functional tests are used as return to sport decision tests. However, the purpose is also dependent on the perspective and the context. So, after the injury, the context and the perspective from the patient would maybe be, how bad is my injury? While the therapist will do the testing, thinking which impairments affect knee function and which exercises are appropriate to target impairments. For the effect of treatment and change, the patient will think, have I improved? The therapist will think, is the rehab progression as expected? For a preoperative assessment, we would like to be able to say something about how the knee will be in the future. The patient will think, can I return to sport? Do I need surgery? And the therapist, on the other hand, might think, which treatment option will give the best odds for adequate long-term knee function? Could be going through surgery, or maybe also to continue rehabilitation. And I guess we'll be speaking more about that later today. In the clinic, we use rehabilitation milestones to decide the